Welcome to the Deep Dive. We're your shortcut to getting properly informed fast. Today, we're focusing on something you'll definitely encounter, especially if you're revising pediatrics: threadworms.
That's right, also known as pinworms.
Now, I know what you might be thinking: threadworms. Sounds pretty basic, right?
But even common things like this have really crucial details, high-yield details, especially for exams like the MSRA.
Exactly. Revision notes can be dense, so our job today is to pull out those key nuggets on Enterobius vermicularis.
We'll cover the essentials: what they are, how you get them, who's at risk, what happens inside, other possibilities, how common they are.
The symptoms, tests, treatment, outlook, and potential problems. The full picture.
Precisely, a high-yield tour.
Okay, let's start right at the beginning. Definition. What exactly are threadworms?
So threadworms, or Enterobius vermicularis if we're being scientific, they're basically small parasitic worms. Roundworms, technically.
And they live in humans.
Yes, specifically in the human intestines. They're super common, particularly in children here in the UK.
How does the infection actually start?
It all begins when someone swallows the eggs. These are microscopic, so you wouldn't see them. They're just sort of out there in the environment.
Right, swallowing eggs. And then,
Well, the female worm has this interesting habit. She travels out of the anus, usually at night, or sometimes to the genital area in girls, and lays thousands of eggs.
okay. Is that what causes the itching?
Exactly. She secretes the sticky stuff with the eggs, and that causes really intense itching. But remember, the eggs have to be swallowed to cause a new infection or reinfection.
Got it. And the life cycle inside. Eggs hatch where?
The larvae hatch out in the small intestine. Then they travel down to the colon to mature into adults. That takes about 2 weeks.
2 weeks. And how long do the adult worms live?
Not that long, actually. Usually up to about 6 weeks.
Okay, so 6 weeks. And the source is always ingesting those eggs.
Always. From contaminated surfaces, fingers, food, anything that's come into contact with eggs laid around the anal area. It's that cycle. Lay eggs, eggs contaminate, eggs get swallowed, hatch, mature, lay eggs again.
It sounds very efficient in a slightly horrible way.
It is. That fecal-oral route is very effective for them.
So who's most likely to get caught in this cycle? What are the risk factors?
Children, definitely. Especially younger kids in school or daycare settings, all that close contact,
Makes sense. What else?
Well, personal hygiene plays a huge role. Not washing hands properly after the loo or before eating is a big one.
Right.
And just being in close contact with someone who's already infected. That obviously increases your risk.
And you mentioned environments.
Yes, crowded living conditions.
Yeah.
Anywhere people are living in close quarters, it just makes transmission easier.
Okay. Let's trace the journey again. Pathophysiology. Egg is swallowed.
Right. Swallowed, survives the stomach acid, reaches the small intestine. That's where it hatches.
And a little larva emerges.
Yep. This larva then makes its way down to the colon, finds a nice spot, matures into an adult worm over about 2 weeks.
And then the females start their nightly migrations.
Exactly. Down to the perianal skin, lay the eggs, cause that itching. The person
You
scratches.
see has eggs on their fingers, under the nails.
Precisely. Then those fingers touch mouths or touch surfaces, bedding, toys, food, and the cycle continues, either reinfecting the same person or spreading to others.
So that 2-week maturation and 6-week lifespan are key timings.
They are. Helps understand the treatment and hygiene timelines, too.
Now, that intense nocturnal itching seems pretty specific. But what else could cause similar symptoms? What are the differential diagnoses?
Good question. You always have to consider other things. Simple irritation, maybe from soaps, detergents, bubble baths, even tight clothes, could cause perianal itching.
Okay, irritants. What else?
In adults particularly, you might think about hemorrhoids or perianal eczema. They could both cause significant itching down there.
Right, more common in adults.
Then there are skin conditions like psoriasis, which can affect the perianal area, or even something called neurotic excoriation, where itching is more psychological.
Okay.
And it's a sensitive point, but particularly with perianal symptoms in children, you do have to keep the possibility of sexual abuse in mind, although it's rare. Needs very careful, expert handling, obviously.
Absolutely. Anything else?
Less commonly, maybe other parasites or digestive issues could potentially mimic some symptoms, but threadworms are by far the most likely cause of that specific nighttime itch in kids.
So just how common are we talking, epidemiology-wise?
Oh, incredibly common, especially in UK school kids. It really cuts across all socioeconomic groups.
So it's not just linked to poverty or anything?
No, not really. Though, as we said, crowded conditions can make it spread more easily. It's actually the most common worm infection we see in the UK.
Wow. Most common. Do we have any figures?
Yeah, the stats suggest around 40 GP consultations per 10,000 people annually. specifically for threadworms.
40 per 10,000. And the main age group.
Peak age is typically 5 to 9 years old. But honestly, anyone, any age can get them. Families often pass them around.
Right. Okay, so let's talk clinical features. What do they actually look like, and what are the symptoms people report?
The worms themselves, the females you might see, are small. About a centimeter long, thin, white, and pointed at both ends, hence the name threadworm.
Like little bits of white cotton thread.
Exactly like that.
Yeah.
And the number one symptom, the classic one, is that intense itching around the anus, especially noticeable at night.
The nocturnal pruritus Annie.
That's the one. But other things can crop up too. Kids might be restless, irritable, have trouble sleeping. Sometimes there's mild tummy discomfort.
Can you always see the worms?
Not always. Sometimes you might spot them around the anus or in the poo. But here's a key thing. Maybe up to 90% of people with threadworms have no symptoms at all.
90%. Asymptomatic.
Yep, so someone could be carrying them and spreading them without even knowing.
That's quite something.
And in girls, remember the itching might be around the vulva too. So if a prepubertal girl has vulval itching or irritation, definitely think threadworms.
And you mentioned they can look like skin flakes.
They can, easily missed. White, tiny. Sometimes the only sign might be disturbed sleep, or maybe a parent just happens to spot a worm during a nappy change, even with no other complaints.
Okay, so symptoms can vary a lot or be absent. How do we confirm it then? Investigations.
Often you don't need formal tests. If you've got that classic story, especially the nighttime itch, the diagnosis is usually clinical, based on symptoms.
But if you do need to confirm,
The best test is the adhesive tape test, or sticky tape test.
how does that work?
You take a piece of clear sticky tape. Hypoallergenic is best first thing in the morning, before washing or going to the toilet. Press it firmly onto the skin, right around the anus.
To pick up any eggs laid overnight.
Exactly. Then you stick the tape onto a glass microscope slide, and it gets sent off to the lab to look for eggs under the microscope.
Simple enough. What about stool samples?
You can examine stool samples, but it's much less reliable for threadworms. Eggs are only found in the stool in maybe 5% of cases. The worms lay eggs on the skin, not usually in the bowel contents.
So tape test is much better, but often no test needed.
Correct. If the symptoms scream threadworms, guidelines like the CKS often support empirical treatment, treating based on the strong clinical suspicion.
Right. Which brings us to management. How do we get rid of them?
It's a two-pronged attack, really. You need medication to kill the worms, and you need strict hygiene measures to stop reinfection and spread. Both are vital.
Okay, let's break that down. Hygiene first. What does that involve?
Right, it's quite intensive. We advise wearing tight-fitting underwear at night helps stop eggs getting onto bedding. Daily bath or shower first thing in the morning, paying special attention to washing the anal area thoroughly.
To wash away eggs.
Exactly. Change and wash bedding, sleepwear, underwear, and towels daily. Hot wash is good. And importantly, don't shake the items before washing the array. You don't want to send eggs into the air.
Good point. What else?
Keep fingernails short and clean. Discourage nail biting or thumb sucking. Strict hand washing after the toilet, before eating, always. Some even suggest keeping toothbrushes in a closed cupboard and rinsing them well.
Sounds like a lot of effort.
It is, but it's crucial because the eggs are so easily spread. And importantly, you need to treat all household members at the same time, even if they don't have symptoms.
Because of that high asymptomatic rate?
Precisely. Otherwise, someone else in the family could just reinfect the person you've treated.
Makes sense. What about the medication?
The usual first choice is mebendazole. It's available over the counter, suitable for adults and children over 2 years old. It's typically just a single dose, often a chewable tablet.
One dose and done.
Usually one dose, yes. But sometimes a second dose is recommended 2 weeks later to catch any worms that hatched after the first dose. Other options include albendazole or pyrantyl pomade, but mebendazole is common.
And do kids need to stay off school?
No, exclusion from school isn't necessary, but obviously reinforcing good hand hygiene at school is important.
You mentioned pregnancy earlier. Can hygiene alone work?
Yes, it's thought that if you're incredibly strict with the hygiene measures for about 6 weeks, the lifespan of the adult worm, you can break the cycle and clear the infection without medication. That's often the preferred route in pregnancy, if possible.
Okay, that's good to know. So, assuming treatment and hygiene work, what's the prognosis?
Generally excellent. With the right treatment and those all-important prevention steps, most people get completely better with no long-term effects.
But reinfection is common.
It is. Those eggs are hardy and easily spread, so recurrences can definitely happen, especially in households with young children. That's why the hygiene part is just as critical as the medicine. Constant vigilance.
So maintaining good habits is key long term.
Absolutely. Regular hand washing before eating, keeping nails short, discouraging finger sucking, and making sure treatment is effective, maybe repeating it as advised, helps prevent those annoying recurrences.
What about complications? Is it just itching or can things get more serious?
Usually it's just the itching and the sleep disturbance, which is annoying enough. But complications can happen. The most frequent issue comes from scratching.
Breaking the skin.
Exactly. Intense scratching can lead to soreness, inflammation, even little cuts or lacerations around the anus, which can then get a secondary bacterial infection.
Nasty. Anything else?
In really severe, persistent infestations, which are less common, people might experience things like weight loss, poor appetite, ongoing insomnia and irritability, sometimes even enterobius bedwetting.
Okay. And I think you mentioned worms ending up in strange places.
Yes, very rarely. Worms, usually females looking for a place to lay eggs, can migrate outside the digestive tract. They've been found in the female genital tract, causing vulvovaginitis, or even extremely rarely in places like the appendix, ears, nose, liver, kidney, spleen, causing little inflammatory reactions called granulomas. But that's really uncommon.
Wow. Okay. Rare but possible. Any complications from the treatment itself?
The medications like mebendazole are generally very safe. As we said, they're often avoided in the first trimester of pregnancy, just as a precaution. And hygiene is preferred. They're not licensed for babies under 3 months.
So for tiny babies, it's all about hygiene.
Yes, super strict hygiene, frequent nappy changes, maybe every 3 hours, meticulous cleaning. But overall, serious complications from either the worms or the treatment are not common. Prevention really is the best approach. Good hand hygiene, discouraging nail biting, prompt treatment.
Okay, let's try and nail down the absolute key takeaways for revision.
Right. Threadworms. Think super common, especially in kids. Think itchy bottom, worse at night. Diagnosis often clinical, but sticky tape test is the gold standard if needed.
And management.
2 key things. Mebendazole, usually a single dose, maybe repeated, and treat the whole household. Plus, relentless hygiene for about 6 weeks. Hand washing, short nails, daily washing, clean bedding.
Got it. It really drives home that even simple-sounding topics have these crucial details for effective practice and, well, for passing exams.
Absolutely. Remember those mnemonics, maybe? Itchy bum at nighttime, sticky tape in the AM, treat the house, clean the house. Little hooks like that can help it stick.
Perfect. And speaking of helping things stick, if you want more high-yield revision material like this, especially for the MSRA, definitely check out passthemsra.com.
And there's also freenessarray.com for loads of free questions and resources, too. Really useful stuff.
Definitely worth a look. So threadworms common, itchy, treatable, but hygiene is king.
That's the essence of it.
And here's something to think about. Given how many infections are asymptomatic, just how widespread are these things silently circulating? Makes you consider the real importance of basic public health hygiene awareness, doesn't it?
It really does. Something to mull over.
Thanks for joining us on The Deep Dive.